Welcome back to Colorado & Company. I'm Denise Plant, and many people think that in order to look fantastic, cosmetic surgery is often required. But Dr. Jeffrey Raval from Raval Facial Aesthetics is here today to show you how you can look great with a few in-office treatments. Now today he has details of the ultimate facial makeover. This morning, it's always great to welcome back the good doctor, Dr. Jeffrey Raval. He has brought one of his patients, Stephanie, who has had a few treatments but no actual cosmetic surgery, and you look fantastic.
Thank you.
Welcome to the show. So Dr. Raval, I understand you can look great, feel great. This requires less downtime. You don't have to have surgery.
That's correct. You know, there's been a lot of advances in cosmetic surgery or cosmetic treatments in the last few years. A lot of it stems from a better understanding of how we age. We know better now how the sun affects the skin, causing fine wrinkling and sunspots and age spots. And we have probably the biggest thing that's happened in the last 10 years is a greater appreciation for what we call volume loss. And that is, you know, we go from I like the analogy, we go from a grape to a raisin as we get older. And it's not so much that gravity is pulling things down and we need surgery to lift things up, but we really need to just re-expand the raisin to more of a grape form to kind of give you a more natural looking facial appearance.
So all of this knowledge that you've learned has really helped advance treatments then?
That's correct. So we have lasers now that can target, okay, so now that we know that there's some collagen breakdown, sunspots and age spots, we can formulate lasers now that can target, let's say sunspots or age spots, or certain lasers that can target wrinkling and collagen formation, and then we can play with the settings a little bit so there's less downtime, less pain. In addition, because we know of the volume loss problem, we've made advances in facial fillers. They last longer now, they're much more natural looking, and they've largely, because they last so long, they really have become a very effective way of anti-aging for us, for treatment for anti-aging.
A lot of my friends go to see you. I mean, I've gone to see you several, as a matter of fact, Nisi needs some more Botox right here. But Stefania, what made you decide to go see Dr. Jeffrey Raval?
Well, I'm in the healthcare industry, and within that industry, Dr. Raval has one of the best reputations. So a lot of us in the healthcare industry go to see him.
And can I look at some pictures? Do we have some before and after pictures that we're going to take a look at? And doctor, can you tell me all of this was done in-house?
Yes.
Okay.
So she's the typical in-shape Colorado woman who loves to be outdoors. Okay, so she's got some sunspots, age spots, some fine wrinkling, and then because she's got literally very low body fat, she tends to, as we get older, we tend to lose the volume, and you see it in the face more than you know, the other parts of the body. So this is what we've done afterwards. We did some laser peels on her to help smooth out the wrinkling, reduce some of the sunspots, age spots, and then add some facial fillers along her eyes. I think the biggest change is around the eyes to get rid of some of the tired look. We're even doing injections into the upper eyelids now, believe it or not, as opposed to surgery, to add the volume into that area.
Okay, did you have any pain, Stefania?
No, relatively none.
Okay.
And really there's no downtime either. So you have instant results, which I love, you know, and you just feel, when you feel like you look better, you feel better, you know, and I had crevices, wrinkles, sunspots, unreal.
Yeah.
So,
who wants crevices?
yeah, and they were crevices.
Yeah. My husband tells me, if you don't like that wrinkle, go jogging. I'm like, jogging's going to make this wrinkle get worse. It's not going to make me look better. Yeah. So this is so easy. You're actually going to do this right here. You're going to show us a demonstration.
Correct. So again, the fillers are so simple, we're going to do a demonstration. But there have been a lot of advances too. I'm going to go ahead and get up and come around. So we're going to use Restylane, but there are other great fillers as well. The great thing about Restylane now and some of the other fillers as well is that they've added, it's gone to Restylane L, which the L stands for lidocaine. And lidocaine is a numbing agent, like when you go to the dentist. So it helps reduce the amount of pain. I go a step further and actually add even more lidocaine with what's something called epinephrine. Epinephrine helps squeeze the blood vessels down, and it reduces bruising as well. So we add more numbing to it, and then we add a little bit of epinephrine to bruising. Now, not everybody is a good medical candidate to add all these agents, but we'll talk, and when the patient comes in, we find out, and as long as you're a good candidate for some of these agents, we go ahead and add it. Now, this has already been added into this Restylane syringe.
Okay.
Here's another great advancement, newer needles. You never would have thought this, but the newer, smoother needles they glide in better and they produce less pain. So Stefania, what we have here is we've already rejuvenated her eyes in the office. She still has some volume loss along the cheek area. And this is where we're going to do our injection today. I've already cleaned her off with alcohol, and so she's basically ready for the injection. So we're going to just go ahead, and again, we just want to kind of fill in this area.
And this is instant results, right, doctor?
Yes.
Okay, so
we're just going in, and you know, I always tell this to a lot of patients when they come in when they're in their late 30s, early 40s. Go ahead and take a look at your picture now versus a picture, let's say, when you were in high school. And think about it in terms of volume. And you will see that the main difference between a 30-year-old and an 18-year-old is the fullness in their face. And so really what we're doing is we're adding the volume back.
Going back to a grape from a raisin,
yes.
as you say.
Yeah.
Okay.
And you can see I'm about halfway down with this syringe on this side, minimal bleeding, and you can already see right here how we added a little bit more fullness into this area.
It gives her that contour. Now, did you feel anything, Stefania?
Hardly anything.
So you feel fine?
Yeah. I mean, you don't feel the needle. So it's just painless.
Yeah.
And it's wonderful. You can walk out of his office
and go. Yeah.
Great.
So you could do this on your lunch hour.
Yeah.
So I can be like, Drew, I'm going to go get a hamburger and go get this done and be back, right? Wow, that's amazing.
Yeah.
Very, very cool.
And it is kind of one of those lunchtime treatments. You can come in, get a treatment, usually there's minimal bruising, and you can head right back to work.
Okay, I want to see some other before and afters. These are more of your patients.
Yes, this is another patient, again, full treatment. So we had laser peel, filler around the eyes and the lips, and Botox to the forehead, frown area, and you can see what she looked like afterwards. So kind of a before and after.
Yep.
Again, tired look, looking a little bit older, not so tired. This patient, a lot of skin damage, so she was more laser peels, but we also added volume and some Botox to her as well. And you can see she had 3 micro laser peels, as well as Botox and filler around the eyes.
Big difference there.
Now this one I put in because it wasn't so much fillers in the office. She did have a fat injection, so there are surgical options that have a little bit more permanence. But she did have the laser peels in the office, and then we did some surgical fat injections into the face, which does last a little bit longer.
She looks healthier.
And yes,
I
mean much younger. It looks like she's older, 80s, but you know, with the fat injections and the lasers, much younger, much more rejuvenated. We're finding with fat injections, there's a little bit of stem cells involved with them as well, and the skin actually improves from the injections, from the fat injections as well. We think it may be the adult stem cells that are contained in the cells, in the fat cells, that are rejuvenating the skin as well.
Interesting. And you know what else I've used from you is your facial line, because growing up in Lake Havasu, always on the beach, I'm starting to get like brown spots.
Right.
But that reduces, it's just cream you put on at night.
Right. And you know, that's an intricate part of our whole treatment regimen, is being on the right skincare. Being on the right skincare really does help. So, being on a retin-A or a bleaching agent, plus being on the right sunblock, especially when you go outside to really protect your skin.
Sunblock, yes. Thank you. Always nice to have you on the show. Thank you for letting us see the procedure.
Thank you.
Again, if you're interested in having the introductory Ultimate Facial Makeover, which includes 40 units of Dysport, 1 unit of Restylane, and 1 micro laser peel for $900, which is a savings of over $300, just recall Raval Facial Aesthetics and Dr. Raval before August 30th. Now his number, 303-381-FACE. That is so easy to remember, 303-381-FACE or 303-381-3223. You can also visit RavalMD.com. And please be sure to mention that you saw Dr. Raval right here on this show, Colorado & Company, when you make your appointment. You'll get that chance to receive that introductory Ultimate Facial Makeover special. The number again, 303-381-3223. Raval Facial Aesthetics paid for this segment. And we should mention Dysport is just kind of like Botox. It's more affordable.
Very similar, yeah.